Good afternoon, my name is Amrita Koshal and this is your news in capsule. With an initial target set at 1 million barrels per day from the Starbrook block from 2027, ExxonMobil last Wednesday revised this to 1.2 million barrels daily from that year. The company began production back in 2019 with the Liza Destiny FPSO at a capacity of 120,000 per day. This was complemented this year when its second FPSO, the Liza Unity, began production earlier this year with a design capacity of 240,000 barrels daily. A third vessel, Payara, is currently under construction with the company already working at full speed to get a fourth production up and running with the Yellowtail development. The news to increase its earlier estimates of production from Guyana was confirmed by the company's senior vice president, Neil Chapman, who was quoted as saying, "Clearly, our objective is to fill up those boats." And also making top headlines today, government confirms a Myla hydro project will not power Essequibo, says Berbice will benefit through link to Demerara system. Russian attacks halt plans to evacuate Ukrainian civilians, and President Ali defends shutting out opposition nominee from NRF board. My name is Amrita Koshal, and this was your news in capsule.
And that's the news of the moment. Remember to get the full details of these stories, pick up a copy of the Kaieteur News. And don't forget, you can catch us on the MyTuner app as well as the Radio Garden app. You can also keep up to date by liking our Facebook page at Kaieteur Radio and subscribing to our YouTube channel, Kaieteur Radio Livestream. Oh, also catch our stream at www.kaieteurnewsonline.com/radio.
If something doesn't look right, then there is something wrong. And if you suspect child abuse, then you must report it to the Child Care and Protection Agency. During this time more than ever, we have to be the eyes and ears of abused children across the country. So if you see it, or you know it, or even if you just think it's child abuse, then you must report it to the police or call the CPA hotline on 227-0979.
A message from the Child Care and Protection Agency, Ministry of Human Services and Social Security, and UNICEF.
Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good afternoon, everyone, and welcome to your Health Matters here on Kaieteur Radio. I'm your presenter, Rehanna Ramsey, and today we will be discussing modernizing care of kidney patients. Joining us virtually are doctors Arifa Aladdin of the Guyana Kidney Foundation and Dr. Kishore Prasad, who is a consultant and head of the Transplant and Vascular Department at the Georgetown Public Hospital. Good afternoon, everyone.
Hi, good afternoon, Rhiannon.
Also, we have with us Brandon Henry, who is a kidney transplant patient. He just came in. I wasn't seeing him. Hi, Brandon. How are you today?
Hey, good afternoon. I'm well.
So Dr. Aladdin is joining us from Canada, and Dr. Kishore is here at the Georgetown Hospital. How are you doing? Are you hearing me?
I'm hearing you fine, Rihanna. Thanks for having me this afternoon.
Dr. Kishore, what about you?
I'm hearing you very clear, Rihanna. Thanks everyone for joining us.
Okay, so today we're discussing modernizing the care of kidney patients, and that is an area that both doctors as well as the patient is very have a vested interest in. Dr. Kishore has Kishore Prasad has been at the forefront of getting legislation up to better the care of kidney patients when it comes to transplant in Guyana. And so we'll talk about that a bit later. But for now, we just want to hear from Dr. Prasad. We're going to go into the program and we're going to hear from Dr. Prasad as to how it is that patients reach that stage where they need treatment for their kidneys. So, Dr. Prasad, I'll just have you weigh in on that, and then I'll have a little bit from Dr. Aladdin.
All right. So there are different stages of kidney failure, and stage 1 to stage 5. The common cause of kidney failure in our country are diabetes, high blood pressure, smoking, and polycystic kidney disease are among the top of the list. Almost 90% of the patient that will present with one stage of the other of kidney failure are caused mainly by diabetes and high blood pressure. Smoking is a significant contributing factor to kidney failure. The other thing to note on this program is that if all of us should live to 100 years, that's one man quote, we all will develop some stage of kidney failure, and that is significant to know about that. So while we will institute all these preventative measures and everything, it is a natural progression that as we get old, our kidney will subject to wear and tear like every other tissue in your body. Now, patients who are uncontrolled diabetes and hypertension are the one who are more likely to develop kidney failure at a rapid rate. And again, poorly controlled diabetes and high blood pressure combined with obesity and smoking contribute significantly to accelerating the stages of kidney failure, and that will lead them to move from one stage to the other, so that at the end point they will require either dialysis or transplant.
And in terms of, we know that there are certain treatment options here in Guyana. We have dialysis and we have transplant. Could you let's talk about what is available and how patients benefit from those. I know recently the government upped the support for persons on dialysis in terms of having a budget set aside for that. Tell us a little bit about that. And Dr. Aladdin, not to worry, coming to you in terms of what the Kidney Foundation, how they're offering support to persons affected by kidney disease.
So Rihanna, the treatment of kidney failure, and we should not focus on the end stage. I'm going to get to that point. But the treatment of kidney failure is to treat the underlying condition. And for the population who are listening to us at this point, if you have sugar or diabetes, pressure, the objective is to focus on control of that. The treatment of kidney failure is to treat the underlying condition. If you are obese, the advice is to go on a diet, lose weight. Seek your doctor and medical advice so that he will screen you to early stage. Because even if you have stage 1, stage 2, stage 3, and even up to stage 4 now, you can go on what you call conservative treatment in terms of managing your weight, your modification of your lifestyle in terms of smoking, reducing weight, and controlling the underlying condition, such as diabetes, high blood pressure. Because that's the two main factors that is actually affecting our population and throughout the Caribbean. And diabetes and high blood pressure, not only the Caribbean, throughout the whole world, is the number 2 causes of kidney failure. At the Georgetown Public Hospital for stage 5 kidney failure, and throughout the country, we have matched the Caribbean and around the world in terms of what treatment is offering in Guyana. And thanks to the government of Guyana and for the subvention in terms of dialysis. And I need the people that are listening here today to know that there are 2 forms of dialysis. There is the hemodialysis and there is peritoneal dialysis. Hemodialysis is the most expensive version of dialysis. And there's peritoneal dialysis, basically is where we put a tube into your abdomen, and there's a special fluid that you will put in 3 times a day and drain 3 times a day and more. That is a more healthy form of dialysis. It's cheaper, you live a better lifestyle, and it tends to actually protect your original kidney and help it to last longer. It is cheaper compared to hemodialysis, which is the most expensive form of medical treatment in this country. The last option is and it is the best treatment for end-stage kidney failure, which is stage 5, where we offer transplant at the Georgetown Public Hospital. Currently, we are offering living donor transplant, meaning is that you have to have a relative, a friend, or some family member who will donate to you. And we will go through the thorough screening and testing and make sure that everything is compatible with you and the donor, and that there's no other coercion or nobody's forced to donate a kidney. Then we'll go ahead and do that surgery. Later on, I see you have a question in regards to the benefit of transplant versus dialysis. So I will get to that at a later point. But that's the process for you to have a kidney transplant at the Georgetown Public Hospital. And that is the best treatment, because what it does, it takes you from a sick patient, a dependent patient, a patient who basically a liability to not only the country, but to the family, because they keep spending money all the time on that patient who basically non-productive. It takes you from a non-productive patient and makes you a productive citizen. And on this program right now, we have Henry Brandon, who is a teacher at President's College. Sorry, Brandon. He's a President's College, who was basically, and is a testimony to the fact of what transplant can do for you.
Yes.
When Brandon was on dialysis, he could not, I'm not going to get into his part, but basically he was incapable of doing anything.
Yes,
at this moment, Brandon is here and he will speak on a testimony to the fact of what can do for you.
Okay, Brandon, will come to you in a bit. Dr. Aladdin, so we know Dr. Aladdin is coming till from, she's zooming in till from Canada. I think she's on on different time zone even. So we know her time, everybody's time is precious, but we know that she's really took time out to be here. So let's hear from Dr. Aladdin as to how the Kidney Foundation of Guyana, sometimes we say Guyana Kidney Foundation, but it's actually the Kidney Foundation of Guyana, is doing their part in terms of bringing awareness and helping to advocate for better treatment of kidney patients here. Go ahead, Dr. Aladdin.
Rihanna, thank you again for having me in the Kidney Foundation of Guyana. And before I get into anything, I'd like to say that this is our start of the World Kidney Week. This is a wonderful way of starting World Kidney Day activities. Our theme for World Kidney Day this year is Kidney Health for All. And this year we're focusing on education, health literacy, and patient advocation. I'm glad that I followed Dr. Kishore Prasad because he said a lot of the things that I would have wanted to say. In addition to all the things that Dr. Prasad has said, what the Kidney Foundation is focusing on directly would be a true patient education. One of the things that we know, as Dr. Prasad rightly mentioned, that when we think kidney failure, we don't have to always think end-stage kidney disease. We don't have to think dialysis and transplant. It's a long process to get to there. So if we have a patient at risk of kidney disease or who has mild kidney disease, those are the patients that we really want to get to control their sugars, control their pressures, eat right, exercise, and hopefully we can reduce their progression or even halt their progression to end-stage kidney disease and avoid them going on dialysis and transplant. That's the majority of our kidney patients, but the first thing we need to do is identify these patients. And what we are hoping to do is through this radio program, through all the programs that we will be having, is to sensitize not only the public, but to sensitize the entire primary healthcare system who see these patients day to day, who interact with them, to screen them for kidney diseases, check their creatinine, calculate their kidney function, and advise these patients. So one of our big tasks that we plan to do is patient advocacy through education and sensitization of our patients and our healthcare professionals. Our second point that we would like to focus on for these patients are resource allocation. We know that dialysis is becoming more and more accessible. At some point, we'd like to see all of our patients having access to dialysis. Of course, that is not going to happen right away because we have patients in the rural areas. We cannot afford to distribute dialysis throughout Guyana. It is a very expensive process. We're glad to see that kidney transplant is going to move to the cadaveric donor, which will increase access to transplant, which is the ultimate treatment that we would like to have for
Thanks to
our
Dr. Prasad and his team and all those who supported that.
Yes, and the government for approving the transplant bill. So that those are all things in the right direction. And the government making dialysis funding more available on an annual basis will ease some of the financial and economic burden of our patients, because that's one of the big things. The third thing that we'd like to advocate for is more social work support. A lot of the patients need mental health. Their families and the people in their communities also need this guidance and the help, because dealing with kidney failure is a life-changing condition, but it's also a very expensive condition. And in Guyana, people, as Dr. Prasad mentioned, Henry was unable to work and do anything for himself. So we need to really support those families. And we also need to advocate for patients to have access to laboratory studies, even if they're not part of GPHC or part of the Ministry of Health, because we're approached a lot of the times by patients who would have private dialysis, but then they don't get access to labs and there is no organized way of getting these things done. So what we're trying to do is that we're collaborating with the Ministry of Health. We're in contact with the chronic disease unit, Dr. Lal, and we're hoping maybe by the end of this year, we'll be able to have a registry of these patients. We'll be able to have these patients get primary care treatment and access to healthcare, and hopefully that this will ease some of the burden of our patients.
Mm-hmm. So moving along, thank you so much for that bit, Dr. Ladding. Moving along, Brandon, we have you looking on and listening on. I'm glad that you're here with us today in health, and you know you're I think you're at work. You look at it like if you're at work on the Zoom here. So thank you for taking time out to talk to us. So tell us a little bit about your experience. I know that dialysis is expensive. Going through this whole ordeal must have been something life-changing for you. You talked to me a bit before coming on the program about how much it has changed the way you have to live, because you basically have to go do a follow-up check, continue going to clinic to keep checking, you know, as that's something that you never had before. That was something that wasn't a part of your life, but now you have to consistently be a part of the kidney care clinic. Tell us a little bit about your experience and what Transplant did for you.
All right. Good afternoon, everyone, all the listeners. Dr. Kaieteur is here. He can testify. Clinic was a must for me even before transplant. I was diagnosed with one of the conditions that he stated earlier, polycystic kidney disease. So it's a degenerative disease. So it takes some time to get to end-stage renal failure, but at some point it will get there, right? Unlike the diabetic forms and high blood pressure and so on, this one definitely you will eventually get to end-stage kidney failure. So it's just a matter of preparing yourself for that time when it comes. For some persons, it takes long or way long or lots of years before they get to that stage. And some persons like mine, I had acute polycystic kidney disease. So it occurred, it regressed very quickly. So I was diagnosed with polycystic kidneys in 2010, and I joined the clinic since then, GPHC Medical Clinic. And I was there, I saw Dr. Kaieteur there sometime in 2015 or 2016, I think. And he started looking at me. My wife is my donor, by the way. She was the one who made all of this possible. Yes. So in 2017, I did my surgery. I did dialysis for like 9 months, pre-transplant surgery. And I can tell you everything that Dr. Kaieteur says about dialysis. It's very tough because I did hemodialysis, so it was expensive. And I wouldn't want to use the strong terms that he used, you know, you become a liability. But to be frank, to be very frank, right?
Yes.
It was a scenario like that, right? A lot of persons, you can feel it. A lot of persons might not see it, right?
Yes.
But it is what it is.
Yes, because you can't work. as usual?
Well, I was given lots of time off, lots of leave of absence and these sort of things, right? One thing I can say, the doctors at the transplant clinic there, they help you in every possible area of life. They try to make your life as comfortable as they possibly can, right? All of the doctors in the transplant unit and my family are very close, right? They call you, you answer as fast as you can because you know something is up, right? And that's the kind of relationship that they promote at the transplant clinic. And you were correct. I have to do follow-up after transplant in 2017. I started doing follow-up. I think it was 2 or 3 times per week in the first 3 months, and then the next 3 months you go like every week, once a week or so. But after a year, you only go once a month. And as we spoke before, it's for the rest of your life. But trust me, it's way better than doing dialysis. It's 100 times better than doing dialysis. Any form of dialysis. I mean, the expense is less because GPAC provide medication, all your lab tests and everything. And the doctors monitor you there every time you go. They check all aspects of your health. And even the donor gets to go and do all of these things that I get to do at GPHC as well. So we're well taken care of. I don't think I saw one of your questions say that, you know, what are some of the issues post-transplant and pre-transplant. Well, pre-transplant, the whole issue is dialysis. I think one of the biggest focus right now is dialysis. I even saw the government passed a bill recently, and they budgeted for dialysis patients and so on. So that's really good. That's moving in the right direction. But my general output to everyone that's listening would be to try to do your best to become aware of what kidney disease is and how you can best look after your kidney, how you can best care for your kidney. You know, we Guyanese, we don't do checkups, you know. You know, the Americans, they check up every month, sometime every week, and every little thing they go to the doctor. We wait until something gets wrong. We're very reactive to our health, and that's something we need to change as Guyanese. You know, you have a family doctor, you go to them, and you check up very often, and that's a part of early detection. I think Dr. Aladdin was referring to that earlier, right?
She's in Canada, so she knows that, you know, that's the way they do it over there.
It's one of the main things in identifying, you know, gripping the issue at hand very early, so it doesn't reach to this stage.
Yes, we agree.
Right.
But
so
in
terms, it for me. Thanks very much.
No, just before you go, in terms of a session of for dialysis, I guess one of the doctors could answer this. How much is it? How much does it cost per session, so that people will get an idea, so that they need to know that, you know, if you don't check on your kidneys and you end up with kidney disease, it could be a very serious matter, not just to your health but to your finances. How much is it per session, and how many sessions did you do per week?
When I did dialysis in 2016, I was paying $12,000 per session, and I had to do 3 sessions per week.
Wow!
But one of the things I had going for me was that I'm in the public system. I'm an employee. I'm a teacher. Dr. Kaieteur alluded to that earlier, and so I pay NIS. So NIS actually caters for 80% of your claims. You can claim back 80% of your expenses. So on every 12,000, I would get back 9,000 from NIS. But if you're not in that position like I was, then it gets even more difficult.
Well, thank you for answering that question, because actually there's somebody who just messaged on Facebook, and because we're live on Facebook, and that's why I'm getting to see you, and asking if dialysis is covered by insurance costs in Guyana. So there you have it. NIS covered Mr. Henry's dialysis costs because he was a contributor, but I don't know about private insurance. Probably Dr. Kaieteur could tell, Dr. Prasad could talk about that.
There is some insurance company that covers the same coverage of 60 to 80% of your dialysis costs. But once we know for sure that the NIS, National Insurance Scheme, is covering 80%. But the ones that having the hardest time is those patients who do not have any insurance coverage, which is 50 to 60% of Guyanese, and have no insurance or NIS coverage. The issue is that the cost of dialysis right now is ranged between $12,000 to $15,000.
So it's increased.
per session. And most people need to do approximately 2 to 3 sessions. So they will spend approximately $36,000 to $45,000 per week.
Wow.
You're talking about $180,000 to $200,000 per month. And that leaving out the cost for medication, the cost for doctor's visit, and the cost for one of the most important injections they need to get during dialysis, which is erythropoietin. That costs approximately $6,400 to $6,500 or $7,000. And one of these patients uses 2 to 3 injections per week. So when you add up the cost, a patient spends approximately $3 to $4 million annually for dialysis. I have recently presented to this at CME, where I show the cost to dialyze 24 patients alone for 5 years is approximately $256 million compared to the cost of the drug for transplant, which is approximately less than $2 million. So economics, what the first world has based and why transplant has been promoted throughout the whole world. And that's because transplant, it moves you from being a dependent patient to being a productive patient. You go back to work, you can take care of your family, you pay taxes, and you become an asset to the economy of your country. Versus you're a dialysis patient, regardless of how you get it from the NIS or you get a grant from the government, at the end of the day, you're draining the economy of this country. The other thing about dialysis is that the quality of dialysis is what matters, and that is an important thing I need to highlight here. Where our dialysis, and we need to be straight up, our dialysis is nothing compared to what you will receive in Canada and the US or the UK. If you look at our dialysis machine that we are using at present is 2008K. And you can ask Dr. Arifa what the dialysis unit looks like over there. They have all the bisphosphonates, you get regular injection, erythropoietin. The management is completely different. To find dialysis and to manage kidney failure patient is one of the most expensive treatment around the world.
I see Dr. nodding.
It's a large chunk of the healthcare budget. So that's why throughout the region and the whole world, they're moving towards living donor transplant, cadaveric transplant, and the promotion of peritoneal dialysis. If you look at Japan, almost 90% of Japan population, the kidney failure patient in Japan is on peritoneal dialysis because it's one of the best form of dialysis and also is the cheapest form of dialysis other than moving towards transplant.
Yes. I don't know if you have like a number of patients. I didn't preempt that. But if you can you tell us like how many patients on dialysis do you have right now? That probably just for Georgetown Hospital. You probably won't have for the entire country.
The last estimate for the amount of dialysis patients around the country is around 200 patients.
Wow.
The nephrologists.
Okay, so thank you so much, Brandon. I know that we're taking up some time from your work, so we're gonna take a short break, and when we come back, Brandon, you can take your leave. Thank you so much.
Yeah, thank you for having me.
Yeah, so, and then when we come back, we'll talk about, as Dr. Prasad was talking about, the importance of transplant, because compared to dialysis, how much it's beneficial to the patient. We'll talk about the new legislation when we come back that will enable cadaveric transplant. So, and that is what would be the dead donor transplant. So stay tuned, and when we come back, we'll have Dr. Prasad and Dr. Aladdin talk about that.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Good afternoon. Welcome back to Your Health Matters here on Kaieteur Radio. So we're talking about modernizing the care of kidney patients here in Guyana, and Dr. Kaieteur Prasad from the Georgetown Public Hospital. He is the head of the Transplant and Vascular Department there, and he's also a consultant with the GPHC, as well as Dr. Rifa Aladdin from the Kidney Foundation Guyana. They're here with us here on Kaieteur Radio Live. We're streaming on Facebook, and we're also broadcasting on 99.1, 99.5 FM. And we are in the middle of our discussion, and we spoke about how much dialysis for kidney patients, how much it costs, how much it affects their lives. We had a kidney patient, a transplant patient earlier on the show. He has gone. He's a teacher. He has his duties calling. So we're talking about some of the infrastructure, the legislation, the laws which are required to modernize kidney care here in Guyana, and Dr. Prasad was one of the persons who he and his team had been advocating for a wider range of transplant, not just live donor transplant, but cadaveric transplant, which is the dead donor transplant. Like if somebody goes into an accident and they have good organs in their body, they can sign up, their relatives can sign up for them to donate that, or they can even do it before they die, knowing that they're going to die if they're in a situation where they know that they're going to die and they have certain organs that they can donate. So you'll have to explain a little bit about what that new law means for kidney patients in Guyana, Dr. Prasad, and then we'll have Dr. Aladdin talk a little bit on it. So go ahead, Dr. Prasad.
All right. Rihanna, thank you again, and Dr. Aladdin, thanks again, and to our listeners. So the legislation was passed on the 25th of January. I want to publicly thank the President of Guyana and the Minister of Health and the Attorney General. Special note to the President of Guyana, Dr. Mohamed Fanali. He's a man who kept his word. He listened to us explaining the cries of the Guyanese population and how this legislation would benefit us and the general population in terms of enhances transplantation and overall the health of this nation.
Yes.
Very instrumental in moving the legislation and getting it to Parliament, and it was passed. What would the legislation do for us? The legislation is going to help us both locally and internationally. What the legislation do? First, it protects the citizens of this country. And I'm going to get to that, how it protects the citizens of Guyana. One, transplantation was being done in this country since 2008, unregulated, meaning anyone could have come in this country. You could have sell your kidney, somebody could have taken your kidney somewhere and give it to someone, a foreigner or so. What this legislation does is it put a stop to that. There are only an appointed set of doctors who can do transplant in this country. Any kidney that is taken from someone, there is a specific institution that is known by the Ministry of Health and the Minister of Health, who he would have appointed that team. So that by itself protects the citizens of this country, meaning is that no one can take your kidney unlawfully. No one can certify you brain dead unlawfully. And it prevents organ trafficking by itself. Let's help us regionally. Is that soon as the legislation was passed, our country now is recognized by the Commonwealth nation as a transplant nation. We are now in partnership with all our Caribbean neighbors, Trinidad, Barbados, and Jamaica, in terms of enhancing transplantation among the region. And one way that will help the population is, let us say you, Rihanna, need a kidney, and your husband wants to donate a kidney to you. But your husband cannot donate because the two of you blood group don't match.
Yes.
But your husband matched someone blood group in Jamaica, and that person donor match you in Guyana. What we can do now is bring that donor over here and send your husband to Jamaica. We set the time together, and both surgery happen on the same day at the same time. So, and that will help our population of patients who are considered what you call non-compatible. That is in terms of living donor, that we can actually expand that.
Yes.
So the legislation will do for us as a country, will help us to move towards cadaveric donor. Cadaveric donor is that we're taking someone who is certified brain dead. This patient will, if they met with a stroke or an accident, and the ICU doctor certify, a team of doctors from the ICU, to be frank, will say that they certify using the technology that is available, will certify that patient brain dead. Once they certify the patient brain dead and the family opt to donate their organ, then they will call us in, and each patient can give 2 kidney, can help to take two patients of dialysis, meaning we will take their kidneys and transplant it into 2 dialysis patients. And it also helps us to expand transplantation in Guyana, where soon we will be able to offer someone a liver transplant, a pancreas transplant, which can cure you from type 1 diabetes, and in the future we can expand to heart and lung transplantation. So that's how the legislation will move to help the citizens of this country. And by expanding transplantation at the same time, we have to help to build the support services that will actually help to expand the care offered to the ordinary citizens of this country, because to expand transplantation, you have to build the support services, meaning in terms of drug level, tissue typing, HLA typing. And when you start building all those services, the availability of high-tech medical care to the general population will increase. And that is how transplantation will improve the overall health of this nation.
Dr. Aladdin, would you want to weigh in on what it means, as a support group, as a Kidney Foundation, what this would, because you mentioned it earlier, give us your thoughts on the new legislation.
I think the new legislation is excellent for kidney care in Guyana and for the wider Caribbean. One of the other things that I would like to mention concerning cadaveric donor is that it allows people who families would like to be altruistic. There are sometimes you will have an unexpected death in a family. Say you have a young person who would have died from a motor vehicle accident, and you want to give back. And this is an opportunity for those people to say, this person is young, they have perfectly normal kidneys. They can actually sign up this person and give consent to donate those kidneys. And not just kidneys, with the cadaveric transplant, they can donate any other organ that we're capable of receiving. And it helps the family to make peace. And that's one of the things we find here a lot in Canada. We have this cadaveric donor transplant. We have altruistic donors. It takes a lot off of the dialysis unit, because if we have people starting dialysis every day and we don't have people coming off of dialysis, we are going to be overburdened. And as Dr. Prasad said, quality of dialysis is most important. And quality depends on the type of dialysis, but it also depends on the amount of time you spend on dialysis. So if we have less people moving, less people going on dialysis, more people moving to transplant, we will be able to allocate more time for those people who are probably not candidates for transplant. And there are certain people who may not be a surgical candidate, etc. So it helps a lot in allocating resources, and it also helps the population in understanding how we can, even when we're dying, sign up to be an organ donor. One of the things that developed nations do is that when you're giving a driver's license, they give you a form right there to say, I want to be an organ donor, and they log this. And anytime something happens to you, if you don't retract that, then you would have already consented at some point in time in your life to donate an organ. So that's some of the things that we can do as a population to help this along. And I have signed up to be an organ donor.
Nice to know. So, Dr. Prasad, you're talking about the law and what it can do for Guyana. But in terms of implementation, I know it's a fairly new law, and you have to do some work in terms of getting the population sensitized as to what it is. Because I remember the first time I heard the word cadaveric, I couldn't even pronounce it. I'm not ashamed to say. I was like, what? But this is something that you have to get people you have to get people aware of and help them to understand. So you have to do some sensitization, I understand. Also, in terms of getting it on implemented, you have to have some infrastructure in place. Tell us a little about that, and give us a timeline as to when we can actually have the cadaveric transplants be done in Guyana.
So, Rihanna, thanks again for asking that question. And thanks to you and the Kidney Foundation and all others out there who are highlighting the burden and the suffering of the kidney failure patient and what is happening in this country. And again, I said thanks to the President of Guyana for allowing us to have this law. There's a special person I want to say special thanks, and that Dr. Ramsamy, who has been the backbone in helping to move that legislation to Parliament. And silently he sit by and he get things done.
Yes.
He don't take any credit for himself, but I just want to bring him. Dr. Ramsamy has been very much instrumental in drafting and supporting us, and all of us here can be a testimony to that fact of the way he helped in dialysis in this country. And he was the man was brave enough to say that transplant is possible in a third world country like Guyana. And today the credit must go out to him for his braveness and to entrust this country with transplantation. Having said that, the cadaveric transplant program will come on board, and we are hoping to have it done, the first cadaveric transplant in this country before the end of 2022. The only thing that is stopping us at the Georgetown Public Hospital to have the cadaveric transplant implemented is to have a tissue typing lab. We are incapable of doing the cross-match test and tissue typing in Guyana at this moment. And all we need at this moment is to have someone trained to do the tissue typing and cross-match testing. And we need to have the lab implemented in Guyana. Is to use the reference lab or the lab at Georgetown Public Hospital with the necessary equipment and reagent. I know Dr. Ramsamy has been working with Nortel, and we also have promises from the University of Calgary to train one of our doctor or medical personnel to do that lab. Also, I know Northwell is on board to help us with the training and the implementation of the tissue typing in Guyana. That is the only component at this moment that is preventing us from starting cadaveric transplant in Guyana. There's nothing holding us back. The ICU team of doctors and the anesthesia and the theater has excellent doctors, very supportive staff. They're on board with us, and we are ready to go with that. Dr. Pedro from the blood bank is all on board, and we have multiple meetings where we are set and ready to go. The only thing that is holding us back at this time is to have the tissue typing test done in Guyana. And one of the things is that you will hear rumors of saying, oh, the test is so expensive, why are we doing it? What is to note at this point is that Jamaica, Trinidad, Barbados, and all the leading Caribbean countries are right now upping their transplant program. And that's because they, like I said before, they realize the economic costs of how much they will save for every person that get transplanted. For example, as we speak right now, Grenada have 4 patients they want to send to Guyana to be transplanted. And we've recently, that's because we have done a transplant for them successfully. Dr. Bristol, who is back there working and a productive citizen in her country and promoting transplantation. So the lab by itself is going to benefit this country, because we can then offer our neighboring country the same test in Guyana. So it will help in what you call sustainability for itself.
You talk, but there's something I came across recently about wider screening, and this is outside of transplant. I just remembered it, so I just let me ask, since you're talking about some of the infrastructure, wider screening. The Ministry of Health, I believe, is pushing for that. How important is that? And as well as in terms of you mentioned Calgary and another place, North Shore. I didn't get that. Those are international people who are collaborating with our local entities to get that up and running. That's what you're saying, in terms of the lab.
So it's Northwell who is in partnership with the government currently by the Ministry of Health to help improve the health standard in Guyana. Now, in terms of wider screening is to screen the general population, to make it simple, so that they could identify patients with different stages of kidney disease. One of the things to that is very good. That is very good. But what that will do now is that it will increase the amount of patients in the nephrology clinic and all the clinics around the country.
More work for you.
Because we can then prevent and slow the progression of the disease by enhancing their medical care, dietary advice to them, get social worker to work with them. That will decrease in the amount of patient that will move from one stage to the other. But again, it will identify a large population of patients who have some form of kidney disease. That still will not prevent the amount of transplantation that will happen or the amount of cadaveric transplant that should happen. And it will help us to minimize and slow the progression of the disease way into the future.
Dr. Aladdin, you want to weigh in on that question? It's about the wider screening for kidney patients, kidney disease, sorry.
Yes, in addition to improving kidney care in Guyana, one of the other things that the screening can do is that it can help to identify patients at risk. Sometimes there will be a population of our patients who may not have kidney failure from diabetes and hypertension. They can have lupus and they can have other autoimmune diseases. That is important information for a transplant team to be aware of, because some of these diseases will recur after transplant. Now, if those patients have diseases that are at a high likelihood of recurring after transplant, we need to be aware and we need to be prepared, because when you see the creatinine or signs of that kidney failure coming on again, we need to know, is this rejection or is this disease coming back? And if it's one or the other, there are two completely different treatments that you need to do. You need to treat the recurrent disease or you need to treat the rejection. And so knowing what is the cause of your primary kidney failure is important when you are going to be a transplant candidate. It is also important if you're looking into being a living donor transplant, where you have a relative planning to donate a kidney to you and there is a genetic condition or something in the family that is causing kidney failure, then you wouldn't want to take a kidney from your sister who might be at risk of having kidney failure herself later on in life. So these things will help us to form this registry with all of this data to know which patients are best for which type of transplant, which patients cannot progress to that. In addition to that, screening will be one of the ways of actually sensitizing the population. If you go to your doctor or to your health center and you're asking to be screened for kidney disease, you were asking someone to tell you what screening is. You were asking someone, okay, now that I have been screened and my kidney function is normal or it's slightly reduced, what can I do? And someone will tell you what to do. And one of the things the Kidney Foundation is doing is that we're working with primary health care. We're trying to put educational information out there in simple language for patients. And we're going to have these information disseminated at health centers. And we are encouraging patients to go to health centers to have screening done.
And who should be screened? I'll have Dr. Prasad, because I don't think that everybody that goes to the hospital or just everybody should be screened. There's certain patients that should, and we don't know if our equipment and our capacity, we can screen everybody. But there's certain people that should check up. And Dr. Prasad, could you touch on who are these patients? Who are the persons that should sign up for screening for kidney disease or kidney signs of kidney?
Everyone that visits the health center should be screened.
Wow.
Everyone for your regular checkup should be screened. Because if you look at the incidence of kidney failure throughout the world, you'll find that 1 in every 5 patients that has diabetes and high blood pressure will have some stages of kidney failure. And I think the last one I saw is that every two persons in every 10 patients that asymptomatic, you can be a normal sitting right now talking to me, or me sitting talking to you, and have stage 1 or stage 2 kidney disease, and we do not even know that we have it. So because of the silentness of the symptoms and the progress and the secretness of how the disease progress, I will advise that everyone, once you're going to the health center or you're having a regular annual checkup, you should be screened for kidney disease.
Okay. And in terms of, you should be screened, but in terms of, let's say, can persons live long? Like you said, they're asymptomatic. There are some persons that are asymptomatic with kidney disease. How long is your lifespan? If you have probably on the lesser, more troublesome end of kidney disease, how long is your lifespan? Can persons live long with kidney problems? How long can they live?
I can talk a little bit about that, Rihanna. And one of the things we are trying to say to this program and to all of the gynaes out there is kidney failure is individual. It depends on what causes your kidney failure. It depends on how good you control your blood sugar, your blood pressure, obesity. And so if you are at risk or you have mild kidney disease, you could actually live your entire lifespan without reaching stage 5. Without needing dialysis and transplant. And that means you need to have strict blood sugar control, strict blood pressure control. And even with kidney failure, we want you to have, we will say, okay, we want your blood pressure to be 140 on 90 on a normal. That's their maximum. But if you're a kidney failure patient or have any signs of kidney disease, we will drop that number to 120 to 130 because we want lower pressures, which will cause less damage to the kidney. Sugar itself can cause damage to the kidney. It is toxic. So if your kidneys are filtering blood that has high sugar levels, that in itself is damaging. If you are obese or you have any overweight, your kidney has to work to filter extra body mass. Your kidneys are the size of your fist. You have 2 of those, and it's filtering all the blood that your heart is pumping every minute, 4 to 5 liters throughout your lifespan. Every weight that you put on will add more burden to that kidney. So you can do things to actually slow or stop the progression of kidney disease. However, patients like Brandon that we had on earlier, he has polycystic kidney disease. There isn't much that he could have done to prevent his kidney from progressing at the time it would have progressed. So it depends on your underlying cause. It depends on your risk factors, and it depends how proactive you are. And we rightly said earlier, we are a reactive type of people in Guyana. No, we want you to be proactive. No, we want you to take your health into your hands, take your kidneys into your hands, get a baseline creatinine, and then follow those numbers. Control your sugar, control your pressure, watch your weight, and you can actually play a lot in preventing yourself from reaching end-stage kidney disease.
Dr. Prasad, in terms of the general population, how many gynaes would you say a percentage would have some form of kidney disease or kidney problems, as you would say in local terms?
So I cannot specifically say for Guyana what's the amount, but I could give you based on the incidence. So the incidence of kidney failure around the world is approximately 15% of your population, which is account for approximately 37 million Americans likely have one form of the stages of kidney failure. That will approximately 112,500 patients in Guyana will have from stage 1 to stage 5 kidney disease.
112,000. Wow. That's a number.
If I may add, one of the things that I would want to add to that is that this number is increasing with year. As our technology get better and life supposedly improve, kidney failure rates are increasing in developed world. So we need to know that if that's happening there, it's going to be the same thing in the Caribbean as well.
Rihanna, thing to add there is that Guyana has a high incidence of diabetes, high blood pressure. Our lifestyle, in terms of the amount of carbohydrates we consume, is significant. And with COVID and the pandemic, because COVID has a significant hit on the kidney also. So that's what is showing throughout the world in terms of the rise in kidney failure among the general population and contributed to a significant increase in kidney disease.
Mm-hmm. Yes, and COVID has affected even the work of the foundation all across the health sector. COVID-19 has put basically put a wet blanket on some of your activities. I know that we're coming down to a couple of minutes to the end of our program, but just give us quickly. I don't know if the kidney department, the vascular department has anything coming up for World Kidney Day, but just give us a bit on your activities. We'll have Dr. Aladdin go for us, and if you have something to say, Dr. Prasad.
Okay. Thank you for giving me the opportunity to speak about World Kidney Day. We have a series of activities as we do each year, and this year will be even better than the previous years. We have teamed up with the Ministry of Health, Georgetown Hospital. We have the Regional Health Authority for Region 6 being on board. We are planning to do a workshop in Region 6. Today, they're having a luncheon for the dialysis patients in Region 6, and Region 6 has actually restarted dialysis. So they are going to be doing a series of activities supported by the Kidney Foundation, GPHC, and the Ministry of Health. We're having a lot of patients and family interviews, because we want the general public to know what the kidney failure patient experiences. And we think by airing these stories out there, we may be able to highlight the problems and sensitize people into taking more care of their health. We are going to be circulating educational materials to the general public in layman language, and we're also going to be circulating materials to the primary healthcare teams. And so that will help in terms of screening and providing information. We're also planning to launch a nutrition booklet for Guyana, and we're working with PAHO and the Ministry of Health through Dr. Ramsami's office, who's been instrumental in helping us collaborate and come together for the one cause of fighting kidney disease in Guyana. And we think Guyanese people, as Dr. Prasad said, we eat a lot of carbs. We have access to everything. Food is readily available, but we don't make the right choices. And so we think if we put a nutrition booklet out, one for our kidney disease, and kidney failure patient diet is different from the other diets. And we can tell people, this is what you have available. This is how cheap it is. This is what we can do to help you. And so those are some of the activities we'll be doing. We're having a World Kidney Day medical education session launched on Wednesday. That is for all the medical professionals, and we're going to start talking about kidney care then. In addition to that, for our 2022 activities, we will be helping with some of the dialysis and transplant medical education sessions through the University of Calgary to help sensitize our population and the doctors on the transplant bill, what is needed, and how beneficial that is for Guyanese.
So Dr. Prasad, if you want to add anything just before we wrap up.
Rihanna, thanks to you and the other journalists and the Kidney Foundation and all other personnel out there who helped to promoting kidney awareness and kidney disease in this country. The Transplant and Vascular Department is basically supporting all of these initiatives as outlined by Dr. Arifa. And we are working with the Georgetown Public Hospital and the social worker, and we just collaborating with everyone to have this promoting in the broadest aspect as we can. And thanks to all of you. 2 years ago, no one actually cares about World Kidney Day in this country. We have moved a far way. And I must compliment all of you who are cooperating to promote this. And thanks much. We will, in the Kidney Transplant and Vascular Department, and I'm sure you have the support of the Nephrology Department at Georgetown Hospital, and we will be supporting all these events.
All right, thank you so much. We've come to the end of our program today. For those who tune in live via Facebook and those who listen via radio, thank you for tuning in. Thank you for listening, and we hope you apply some of the information that you got. Some of you who may be at risk of kidney, even if you're not, it's important to be screened. Get your kidneys checked. Make sure you eat the right foods that would care for your kidney and your other organs as well. And we're still climbing out of the pandemic. I like to say climbing out of the pandemic because we're moving slowly and we don't know what the future is so uncertain, because I was reading recently that I think Japan they were declared COVID free and now they have cases again. So you still have to be careful, you still have to take your shots, you still have to use your mask, wash your hands, and just take good care of yourselves. So thank you, Dr. Kishore Prasad of the Georgetown Public Hospital, and Dr. Arifa Aladdin, who is joining us from Canada. She is the representative of the Kidney Foundation of Guyana. Thank you so much, doctors, for your insight and your information. Thank you to our viewers and listeners. And until we have our next program, be good to yourself and make sure you stay well. Goodbye.
Thanks, Sharon.